Okay, welcome back to Chapter 2 of the Rathus textbook, Introductory Psychology. In the last video, we looked at the nervous system, the different parts of the nervous system, the central and the peripheral nervous system, and then, we looked at how the peripheral nervous system broke down into the autonomic and the somatic nervous system. The autonomic nervous system yet again breaks down further into the parasympathetic and sympathetic. So just a quick recap. We're going to kind of focus back in on the central nervous system, and more specifically, we're going to look at the brain. So that's sort of what this video will be about, is the brain. And to start off with, it's sort of important to think about, how do we know, how do researchers, psychologists, neurologists, etc., how do all these people know about the different functions of the brain? Well, there's several ways we as human beings have learned about our own brains, which is kind of weird to think about, using the human brain to studying the human brain. But one of those ways is experimentation. A lot of research you hear about with brain research, a lot of it, unfortunately, sometimes for better or worse, is involving animals, experimenting with the brain, kind of seeing what happens when certain parts of the brain are stimulated, which parts, what activates or what doesn't activate if we stimulate this part of the brain. Another way of doing so is maybe after somebody has sustained some sort of damage to their brain, either from maybe a disease or some sort of accident. We can use that as an opportunity to study. I don't know why, I don't think the textbook talks about it, but there's an example, a really interesting case study of a man named Phineas Gage, who was a railroad worker. Sometimes that's really hard to say. Who was working on the railroad one day. He was packing, I think, dynamite to blow up, something, that would be where they were going to lay track in or something or another. And he's messing with that, and he hits something. He hits something with his hammer the wrong way, and it sends a metal rod, I guess a railroad spike or something, explodes and goes right up into his face. It goes like literally. I think if you just Google Phineas Gage, you'll find this. The image, it goes into his brain. It damages the frontal lobes of his brain, which we haven't talked about yet, but those are very important. And what we figured out based on kind of studying Phineas before and after this event happened, he survived, by the way. I guess I should have said that he survived miraculously. But he was not the same person afterwards. His personality completely changed. His wife and his family and his coworkers reported that before the accident, Phineas was, a really nice, easygoing kind of guy, easy to work with, easy to get along with. But afterwards, he was really grumpy. He was angry. He was irritable more often than not, to the point, I believe, that if you read the story through, that like his wife leaves him, and all kinds of things happen to him because this huge shift in his personality. But it's because of that accident that we know sort of about the role that the frontal lobe of the brain plays with personality. But that's not something that you can necessarily experiment with. You can't ask people to come into a lab and say, hey, we're gonna put a railroad spike through your forehead and see what happens. They just sort of stumbled upon these kind of things happening. So another way, again, I sort of already mentioned, is you can damage or remove certain parts of the brain in animals. That's one way we know a lot about the brain of not only humans but other beings. You can also use probes to stimulate different parts of the brain to see, hey, if we stimulate this, what happens? If we stimulate the reticular formation system, for example, what happens? Oh, wow, now the animal goes from awake or asleep to awake. So that's some of the ways that we know. Another way that we know so much about the brain is through modern technology, brain scanning technology, which is becoming more and more advanced. The first piece of technology we'll talk about is the electroencephalograph, otherwise known as an EEG. And this is a device that it's like a cap that you wear over your skull that actually measures electrical activity in the brain. Remember, I think the last video or the video before, I talked about how the brain literally has electrical activity going on. You could power a light bulb with the amount of electricity that's going on between your ears when you're thinking or using your brain. And this device is meant to capture that electrical activity. And I think there's a picture on the next slide we'll take a look at. So it detects brain waves that pass between these electrodes that are plugged to your head, and it looks kind of like this. Oops, sorry, went too fast. It kind of reminds me of that old George Lucas movie, the THX movie or whatever. But don't get too creeped out by that. It's pretty harmless. It's just meant to pick up on the electrical waves that are pulsing through your head. That's one way of kind of seeing what's going on in the brain. Here are some other ways. Other brain imaging techniques and technology that are used, computerized axial tomographies or CAT scans or CT scans, depending on who you talk to, positron emission tomography or PET scans, magnetic resonance imaging or MRIs, functional MRIs, which are pretty similar to MRIs. I actually had an MRI done within the last few months. I had surgery on my back and found out I had a herniated disc because I went through an MRI, and it's a very powerful piece of technology, but it's also not a very fun piece of technology to be in. It's very cramped, and if you're claustrophobic, it's not fun at all. I'm not, but it was still uncomfortable nonetheless. So these are if you ever sustain some kind of brain damage or blow to the head, or you're probably going to be subject to one of these brain imaging techniques to see what's going on. Here's kind of what those look like, the different images. You have the CAT scan, gives you kind of this top-down view of the brain. You have the PET scan, gives you more of the side view of the brain, and you can kind of get different, you can see different things depending on, the image, the technique you're looking for. The MRI scan, kind of like the CAT scan, and it gives you that top-down view, but it kind of just not as maybe as detailed as a CAT scan in this image it looks like, but all of this kind of gives you a useful look at what's going on between our ears. So with that in mind, we're going to move on and actually talk about the brain, the parts of the brain. There are a lot of different parts of the brain, and we're going to kind of move through. If you can kind of see my arrow, we're going to move kind of upwards through the brain, starting kind of at the bottom of the brain and working our way outwards. And by doing so, we're sort of tracing the evolutionary history of the human brain as it has developed. So we're going to start out, all of these parts are really important, but we're going to talk about each one of them in various slides. So don't worry about, getting everything written down notes-wise or all of these parts right away. We will come back to them and talk about them. But just sort of, I want us to explore the brain from its oldest parts outwards. And what I mean by its oldest parts, the parts of the brain that have been around for much longer in terms of evolutionary history. Some people refer to, for example, these sort of bottom portions of the brain as the reptilian brain, as the parts of the brain that have been around and species such as reptiles for millions and millions of years, whereas some of this other stuff like the cerebrum and the cerebral cortex, for example, are much newer in terms of their evolutionary history. So anyways, that's kind of the method to the madness we'll take when exploring the brain. So we're going to divide the brain up into three portions: the hindbrain, the midbrain, and the forebrain. So let's first talk about the hindbrain. This is the oldest portion of the brain that I was talking about in the previous slide, what is sometimes referred to as the reptilian portion of our brain. And for the hindbrain, we're only going to focus on three important parts: the medulla, the pons, and the cerebellum. The medulla and pons are really interesting. They're both incredibly important for basic life functioning, like breathing, regulating your heartbeat, all the basic life skills that are the things that you probably do and don't think about, but that are necessary for your survival. So you can thank your pons and your medulla for the fact that you can breathe, the fact you can maintain, a steady heartbeat, you have homeostasis in the body. All of these things are attributed to some of these really, important parts of the brain. In fact, you could technically destroy most of the human brain except for this hindbrain portion, and you would technically be alive, albeit your quality of life would be very poor. You wouldn't be able to do much, but just know that you would still technically be alive. The next portion of the brain I want to talk about in the hindbrain is the cerebellum. The cerebellum is responsible for involuntary, it's sort of like movement. It's like muscle memory, how you develop muscle memory. So the cerebellum is oftentimes involved with movement, and sometimes you'll see that if somebody sustains a car accident, maybe like a motorcycle or a vehicle accident, and they hit their head, One of the things they check for is to see if there's been damage to the cerebellum. And to do this, you can actually tickle the bottoms of their feet. And if their toes flare out in a certain way rather than curl, that's actually indication that they may have damaged their cerebellum because it's messing with the movement of their toes. The way where our toes sort of automatically curl when somebody tickles our feet. It's really interesting. But the cerebellum's part of movement. This is, again, it's part of muscle movement too. Things that you do so many times that you kind of, tying your shoe, riding a bike, driving a car, things that you do all the time that you kind of do on autopilot is sort of regulated by the cerebellum. Another portion of the hindbrain that is important is called the reticular formation. Really, it's just this bundle of nerves that kind of bridges the gap between the hindbrain and the midbrain. What all it really does is it stimulates arousal. And I don't mean, arousal like the hey, hey, hey kind of arousal, but the awake and alert kind of arousal. Like you go from being asleep to awake, that kind of something arousing you from sleep, somebody arousing you from being kind of sleepy and sluggish to all of a sudden you're awake and alert. That's what I mean by, and basically what it does is it relays information to the cerebral cortex whenever it's stimulated, and it makes you more alert. And funny enough, and I don't know, if you like cats, you probably won't like to hear this, but some of the research that was used to find out about the reticular formation was on cats, and they would use these electrical probes to stimulate or electrodes to stimulate this very small part of the brain, and you would have cats who would go from being asleep to just wide awake, and they've got their claws out and they're hissing and they're ready to go. So we know that part of the brain is really important for being just awake and alert. So that's the hindbrain in a nutshell. We're now going to move up to in some textbooks they call this the midbrain. I guess our textbook is going to call it the forebrain, and that's okay. It just depends on who you hear. But, I'm sorry, I think I referred to it as the midbrain earlier. But for this textbook, I guess they're calling it the forebrain. That's fine. Some important parts that we're going to look at are the thalamus. First, the thalamus and the hypothalamus. The thalamus is simply a relay station. Basically, it relays information from the environment, sensory information like sight, sound, taste, touch, and it relays it to the other portions of the brain, specifically the cortex. It's kind of like you got to pass through. If you want to say, go for a ride on the Oklahoma City streetcar, you've got to go to one of the stations. You've got to pay for a ticket. And that's kind of like the thalamus. If the sensory information wants to go to the sensory or to the cerebral cortex, for example, it has to pass through the thalamus first. The hypothalamus, as you might suspect, is located under or near the thalamus. Actually, what the prefix hypo means, I believe, is under. And this part of our brain is incredibly important because it regulates a lot of important things. And it regulates our temperature, how we use fluids, store nutrients after we eat or drink. It's part of our emotions. It's involved with the emotion, but it also satisfies some of the, I think they're called the 4 F's. You have feeding, thirst. Well, it's feeding, fornicating, fleeing, and fighting. Sorry. Fleeing, fighting, fornicating, and anyways. So hunger, thirst, sex, aggression, those things are what's regulated by the hypothalamus. So this thing is a very, very important part of our brain. And I'm going to show you a picture in a moment what all these look like. So it's kind of weird talking about these things without actually seeing them, I know. So, but just know on the next slide there will be a picture. So just hold your excitement for just a moment if you can. I know it's riveting. Also part of the forebrain or midbrain, depending on who you ask, is the limbic system. And this is the part of our brain that regulates emotions. And actually the hypothalamus and thalamus are kind of also grouped into this limbic system, if we really want to be technical about it. But the limbic system, again, is part of regulating memory, part of regulating emotions, and specifically the amygdala. The amygdala is part of the brain, is connected kind of with more negative, maybe primal emotions like aggression or fear. It's also involved in learning and memory. And there's an interesting mnemonic device you might find helpful in remembering what the amygdala is connected to. If you take the word amygdala as it's spelled out on this slide, you can actually kind of turn it into a name. The first name, Amy, middle name, G, and the last name, Dalla, Amy G. Dalla. And when I see that name, it reminds me of the saying that hell hath no fury like a woman's scorn. And when we think about that saying, it evokes a lot of negative imagery as far as like fear and anger and all kinds of powerful emotions are concerned. So I don't know, it's kind of a long road to get there, but it always reminds me of the amygdala, that saying. I heard it at a conference like several years ago when I was a high school teacher, and I can't ever get it out of my mind, and maybe now that you've heard it, you won't be able to either. So anyways, that's the midbrain or the forebrain, depending on who you ask. Here's what it actually looks like. We haven't talked about it yet. The hippocampus here. The hippocampus is here. We have the thalamus. We have the hypothalamus here. The amygdala is on the tip of the hippocampus. I don't know why we haven't talked about the hippocampus yet, but that is part of the brain that is involved with regulating episodic memories. Here's the cerebellum I talked about earlier and muscle memory. The hippocampus is involved in other types of memories. Memory of like stuff that you've done in your life. Memory of your 16th birthday, the day you graduated high school, the day your first child was born, etc., etc. Those are the kind of memories that are stored in the hippocampus. Whereas in the cerebellum, it's muscle memory. Memory of how to ride a bike. Memory of how to shoot hoops or write in cursive or whatever it is that you might have done a lot. So that's the limbic system. That's part of the midbrain we talked about. We're moving up into the brain, and we're about to move into the outer shell of the brain, known as the cerebral cortex or the cerebrum, depending on who you ask or what textbook you use. So the cerebrum is that sort of outer shell of the cortex, out of the shell of the brain, sometimes referred to as the cerebral cortex. It's responsible for higher cognitive functionings like thinking, decision-making, planning, reasoning, logic, and the use of language, which is what separates us from other beings, is our use of language and our higher thinking skills. And so, the cerebral cortex is sort of that outer surface of the cerebrum, of that sort of the shell of the brain. Shell is probably not a really accurate way of describing it, but it's all this sort of pink, wrinkly stuff on the outside of the brain here. It's wrinkled. It's got these ridges and valleys known as fissures, and the purpose of that is to allow for more surface area inside the skull. If you want to do something really interesting right now, I recommend pausing this video or pause this video and go Google brains without ridges and fissures. It's really interesting. There are people who have been born without their brain being wrinkled and having all those ridges. And it's really fascinating to take a look at it. So anyways, cerebral cortex, it's linked with all of our cognitive abilities like I described earlier: thinking, planning, reasoning, decision-making, dreaming, language use, all of the things that we probably take for granted, but are what separates us from other beings. And the cerebral cortex is divided into two halves, two hemispheres, if you will, and it's separated by what's known as the corpus callosum. It's this bundle of fibers that connects the two hemispheres of the cerebrum, and it's created by the fissures, these wrinkles in the brain. And I don't think you can see it on this picture. You can kind of see where it's starting here. This middle line here is where the corpus callosum would be, but there's a better picture later on, I think, in the slides, so we'll come back to that later on. So let's look at the cerebral cortex. It's the outer layer. It's involved in a lot of bodily activities: movement, sensation, perception. It's got two different hemispheres, the right and left. 4 lobes that we'll talk about. Four lobes of the brain that are really important. You have the occipital lobe, which is on the back of the brain, kind of the back lower, kind of near the cerebellum. And this is what's dealing with vision. In fact, really, your eyes don't actually see. Your eyes, what they do is they gather sensory data from the environment, and they relay the information back all the way to your occipital lobes using the visual nerve we'll talk about later, traveling the visual cortex. And the occipital lobe relays the information back as vision. So really, these are your real eyes, your occipital lobe. Your temporal lobes are on the sides of your brain, kind of near your ears, close to your temples and your ears. I think that's what helps me remember that. And they're associated with hearing and auditory functions, hearing things. So very important. The parietal lobe is kind of towards the top back portion of your brain, and it is where the somatosensory cortex is. The somatosensory cortex is your sense of touch. And the somatosensory cortex, I'll show you a picture of this in just a moment, but it's a really thin strip of cortex on the top of your brain that is associated with touch. And on this strip of cortex is each part of your body is represented on a tiny portion of this strip of cortex. So if you stimulate certain parts of the cortex, it'll feel like different parts of your body are being touched. So for example, you could stimulate a portion of this cortex and it would feel like somebody is touching your hand even though nobody is. Same with your leg, your back, and different parts of our body have more space on the somatosensory cortex. Parts of our body that are more sensitive to touch, like our face, our hands, for example, are very sensitive to touch. So they take up more space on the cortex. And I think it's on the next slide. Yeah, this cortex, it's kind of hard to see, but here it is. This purple strip here is the somatosensory cortex, and you can kind of see it laid out here. Each part of our body is mapped onto this cortex. So you see the face. If you stimulate here, you would be the face. And everything, and different parts take up more or less space on this cortex, if that makes sense. So the frontal lobe is very similar. The frontal lobe is the part of our brain I talked about earlier that is responsible for our personalities, what make us who we are as an individual. It's responsible for regulating higher levels of thinking, planning, reasoning, emotions, memory, a lot of important things that are regulated by the frontal lobe. And this is also where we see the motor cortex, and it's very similar to the somatosensory cortex, meaning that there is a small strip of cortex and our motor movement is mapped out on that strip of cortex. And here is what it looks like. So we move a lot of our movement in our body takes place with our legs and our arms and our feet and our hands. So we see those parts of our body on this strip of cortex here take up a lot of space on the cortex. And here that piece of cortex is that blue section. Sorry, it may be kind of confusing. It's really small, but it may help if you pull your textbook up here. So anyways, that is the cerebral cortex. That's in a nutshell the four lobes, and the two strips of cortex are very important: somatosensory and motor cortex. So let's do a truth or fiction, and before we move on. Truth or fiction? If a surgeon were to stimulate a certain part of your brain electrically, you might swear that someone had stroked your leg. Go ahead and pause the video and check your comprehension. Truth or fiction? Okay, welcome back. You should have answered true because we just talked about that, the somatosensory cortex. If somebody were to stimulate a certain part of your somatosensory cortex, it might feel like somebody is touching your leg. We see here are the legs right here. You have toes, foot, leg, hip, trunk, all of that is on this strip of cortex. So if this were to be stimulated somewhere in here, it would feel like somebody was touching your leg, even though nobody was touching your leg. Pretty neat, right? So let's think about some other important areas along the cerebral cortex, known as association areas. They are not necessarily involved in sensation or motor activity, but they are very important for things like learning, thinking, memory, and the use of language. So a couple of them, sometimes they're in the frontal lobes, and they're involved in things like executive function, which is a fancy way of saying decision-making, planning, learning, logic, reason, all those fancy things that humans can do with our brains. It retrieves visual and auditory information and manipulates them, so you can think about things that happened in the past, and you might be able to manipulate those memories, and for better or worse. So let's talk about some important association areas. Specifically, those that are involved in the use of language, because we see that language, interestingly enough, is located specifically in the left hemisphere of the brain. This does not mean that you are left brain or right brain, but we see the association of language primarily taking place in the left hemisphere of the brain. And the left hemisphere contains all language functions for nearly all right-handed people, but we see left-handed people, on the other hand, conversely, it's the opposite. We actually see right hemisphere functioning for people who are left-handed. We'll talk more about handedness, I think, in a couple slides. If you suffer damage to the area, the hemisphere, the area where language develops, you might actually see, before the age of 13, the brain does some really fascinating stuff. You might actually see where some of those skills and functions transfer to the right hemisphere. This is known as brain plasticity. The brain is literally molded and shaped by experience. So even sometimes traumatic experiences, the brain can bounce back. 20, 30 years ago, that we didn't think that was possible, that the human brain could alter and change its functions, or new neurons could generate, or things like that. But we now know with technology and a better understanding that is true. So now let's talk about two specific areas of the brain that are associated with language use. The first is Broca's area. Broca's area is responsible for production of speech. So here it is, a graphical representation. Here's Broca's area. This is the part of the brain where when you are generating speech, this part is flaring up. So right now, as I'm delivering this instruction to you, my Broca's area would probably be flying, it would be lighting up on some sort of instrument. An easy way of remembering Broca's area and speech is, if you're familiar with the Spanish language, the word boca means to, mouth. You speak with your mouth, your boca. Broca kind of sounds like boca. That's easy enough for me to remember. So it's always nice to have little tricks to remember things, because in psychology there are a ton of different terms and definitions and concepts that are alike and dissimilar. So finding ways to remember all the differences is really helpful. The other area is Wernicke's area. I'll flip back to the slide. It's this area here, and this regulates speech comprehension. So the fact that you can understand me right now means your Wernicke's area is working just fine. If all of a sudden, if I were to start sounding like Charlie Brown's teacher, wah, 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 then maybe you have a problem with your Wernicke's area. But otherwise, things are working normal. Damage to, oops, didn't mean to do that. Damage to either slide, meant to go back. Damage to either, oops, sorry folks, lost track. Damage to either area can result in aphasia, basically where the functions, of speaking or understanding speech are not working correctly. So really interesting stuff here. So kind of already talked about Wernicke's area. In addition to that, we have the angular gyrus, which is what translates visual information into auditory information. Basically, this is the part of the brain. I don't know why they don't show it on here. It's in the same area as Broca's and Wernicke's, but for some reason it is not lit up for whatever reason. But it's what allows you to read. The fact that you can read the words on this slide, you're using your angular gyrus. It is, it is what allows you to transmit these visual letters into something auditory that you can understand in your mind. And obviously damage to this area of the brain would result in inability or difficulty in reading, something that we would all take for granted. Broca's area, kind of already talked about that, so I don't want to spend too much time belaboring it. Broca's and Wernicke's area. Broca's aphasia would be difficult to speak. Your speech would be slow, laborious. It'd be maybe harder to understand as well. So left brain, right brain. You hear a lot of debate in psychology. You hear people talk about, oh, I'm left brain. I'm more mathematical. I'm right brain. I'm more creative. I'm more artistic. Well, fun fact that none of that is actually true. You actually use both sides of your brain almost equally. To do almost everything. Granted, like language is, we'll talk about that in a moment. Language is sort of, for most people, language is processed and regulated on the left-hand side, but for the most part, almost all functioning takes place between both hemispheres. Both hemispheres are kind of working together. And so it's not true to say that you are left brain or right brain. And it's also not true to say you only use 10% of your brain. I mean, you may not use 100% of the brain all the time, but it's not true that 90% of the brain is just asleep and the rest, and 10% is what's firing. That's just not true. We know that because we can see it. We can visually see that using the technology we have now. So anyways, next time somebody, tells you they're right brain or left brain, you can maybe gently let them down and say, it's not true, but don't be a jerk about it, I guess. So anyways, handedness, another thing, pretty interesting. We talked about how right-handed people, you see language is more likely to be regulated on the left-handed side. Well, conversely, language is typically processed and regulated on the right-hand side of the brain, or right portion of the brain for people who are left-handed. So, Interesting facts about people who are left-handed: they have greater than average probability of language problems and also certain health problems, interestingly enough. It's correlation, not causation. So just because you're left-handed doesn't mean you're going to have bad health or have language problems. They're more likely than right-handed people to be gifted artists, musicians, and mathematicians. So there's something positive for you there. It's linked to genetics. Being left-handed has, some people saw it as a deficiency. I mean, if you grew up and went to Catholic school and as a child, maybe if you were left-handed, you might have been corrected not to be left-handed. And unfortunately, that was a common practice I hear from friends and family members and other people who I knew who went to Catholic school. Not trying to insult Catholic schools, but you just hear kind of horror stories like that often. So anyways, I think personally I am ambidextrous, so I don't know what the research says about me. I write with my right hand, and I throw with my left hand, and I kind of everything else I do a mixture of the two. So, if you're left-handed, there's some pros and cons it looks like here. If you're right-handed, I guess everything's okay. The world is kind of built for right-handed people. But you can blame your parents whether you're right-handed or left-handed because it comes from genetics. So I want to talk about one last thing before we wrap up our discussion on brains, and that is a thing called split brain procedures. You can, in fact, split the human brain right down the middle and not die, as surprising as that may sound. In fact, it is a common, or I shouldn't say common, it is a form of treatment used for people who have severe epilepsy who do not respond to other medications or treatments. For example, somebody who is having dozens of grand mal seizures a day and are not responding otherwise, and they can't do anything, they can't function normally because of this. A split brain operation might be the way to go. Split brain literally severs the corpus callosum, severing the two halves. It's like having two brains. They are kind of acting independently of one another. Most people live a normal life after having a split brain procedure. It's really interesting that, they might have some kind of quirks in their behavior that might show up. For example, you hear about somebody who has a split brain procedure, and maybe they're buttoning a shirt with one hand, and then without realizing it, the other hand is unbuttoning the shirt. Like if they're not looking in the mirror or something, they're not paying attention. Some weird things like that. I shouldn't say weird, some different things like that. But here's a really interesting, some research with split brain patients, and it's called the split brain experiment. And I'm actually going to use our textbook to kind of help illustrate, because there's just a lot going on here. And it's in our textbook in section 2.12 or 2.12, figure 2.12. So here we have in the drawing, and so what this drawing is trying to indicate is the bilateral symmetry of the brain. And what this means is information that is processed, say, if information hits the left eye, like visual information, it's going to be processed in the right side of the brain, the right hemisphere of the brain. And same thing, if visual information comes into contact with the right eye, it's going to be regulated and processed by the left hemisphere of the brain. This is what's known as bilateral symmetry. Same thing with our hands, same thing with our legs. All of that stuff happens bilaterally. So in the drawing of the brain on the left, we see that the visual sensations in the left visual field are projected in the occipital cortex of the right hemisphere. So here you can see my arrow, left visual field, information is going to, it's being processed on the right hemisphere. On the right, while visual sensations from the right visual field are projected in the occipital cortex in the left hemisphere. In the diagram of the split brain experiment, a person with a severed corpus callosum handles a key with his left hand and perceives the written word in his left visual field. So he's got this key in his hand here, and he's looking at the word key, or the written word in his left visual field. Excuse me. The word key is projected in the right hemisphere. Speech, remember, we talked about Broca's and Wernicke's area. Remember that speech, however, is usually a function of the left hemisphere. It's regulated in the left hemisphere by Broca's area and Wernicke's area. The written word ring perceived by the right visual field is projected in the left hemisphere. So, when asked what he is handling, a person with split brain subject reports the ring, not the key. They're getting this mismatch of signals. They're going to tell you they're holding a ring because they see the ring, they see the word ring, even though they know they're holding a key. They're not communicating back and forth. Somebody who does not have this procedure could tell you, oh, I'm holding a key. But somebody who is not may have difficulty. Oh, I'm looking at the word ring and I'm holding the word key. And when I ask me, I say the word ring. Fascinating, fascinating research. Okay, we're going to stop here. I feel like I threw a lot at you about the brain. This is just a nice overview about what the brain is and some of the parts. There's a lot more that you can learn about the brain. This is just a nice introduction. So let's leave with a comprehension check to make sure we're on the same page before we jump into our last section of chapter 2. So the comprehension check for this section is: the most recently developed level of the human brain is A, the midbrain, B, the forebrain, C, the reticular formation, or D, the brain stem. Go ahead and pause your video and see if you can check your comprehension. You should have answered, welcome back, you should have answered B for forebrain. That's the cerebral cortex. That is the part of the brain that is the newest portion of the brain that is developed. The midbrain and the hindbrain are sometimes referred to as the reptilian brain, or the oldest portions of our brain from an evolutionary perspective. The forebrain, cerebral cortex, all that good stuff is considered the newest. So let's stop here. I don't want to overwhelm you with any more. When we come back, we're going to look at the role of the endocrine system and also the role of heredity plays in our behavior and the way we think. So anyways, I'll catch you all next time.